Hi, this is Dr. Khutbuddin Ali, your eye doctor. So, I am a retina consultant, and on the occasion of World Diabetic Day, that's falling on 14th of November 2024, we at Annur Eye Care are conducting a comprehensive retina screening camp for all the patients, irrespective of whether they are diabetic or not. Because in India, especially, we see a major chunk of diagnosed or undetected diabetes too. So this is one thing I would like to share at the beginning. This will be a complete one-day retina screening, diabetic retinopathy screening camp, starting from 11 a.m. in the morning to 9 p.m. in the evening. On this occasion, I would take this opportunity to describe a few things about diabetic retinopathy. So what actually is diabetic retinopathy? As the name itself suggests, it is the damage that is caused to the retina because of diabetes, more so uncontrolled diabetes. So how the pathophysiology of diabetic retinopathy lies is, so over the period of time, as the sugar levels keep fluctuating, more so on the higher side, the blood vessels in the retina, they get damaged. So over the period of time, when once they are mostly affected by this glycemic levels, sugar levels alteration, these blood vessels rupture and these shed retina red spots over the retina, blood clots over the retina, which we call hemorrhages, and many other changes, exudates in the retina. All these changes fall under the pattern of diabetic retinopathy. So in these two, there are two patterns. One is called proliferative diabetic retinopathy, the other part is called non-proliferative diabetic retinopathy. So proliferative diabetic retinopathy is something to be really worried about, because most of the changes that happen in proliferative diabetic retinopathy, they definitely need an intervention, either with a laser or in some cases with surgery. But no matter whatever said and done, there will be some amount of irreversible damage that will happen in spite of the best treatment with cases with proliferative diabetic retinopathy. The non-proliferative diabetic retinopathy are the early cases of retina damage because of diabetes. These changes might last from small blood clots in the retina, exudates in the retina, very minute visual decrease, all these things. So most of these changes, they cannot be reversed back to normal, but it kept at control. Once you keep your sugar levels under control, once you keep your lipid profile under control, once you maintain a proper healthy lifestyle, all these changes will make sure that this non-proliferative diabetic retinopathy remains in the same stage and not progressing to proliferative diabetic retinopathy. Whatever said and done, it is always better to catch the disease in the early stage. As the adage goes, a stitch in time saves 9. So whenever you catch a disease in the early stage, it becomes easy both for the doctor and the patient to manage the disease progress. Many people, we have to understand, it is a metabolic disorder. It is something which is related to our lifestyle, our genetics, and multiple food habits and everything. So it implies that the responsibility is both on the patient and the doctor to maintain this in a proper way. We all have to adapt a healthy lifestyle, have a regular checkup, and as an eye doctor, that too a retina consultant, I expect every patient who is being diagnosed with diabetes have an immediate retina checkup, a complete comprehensive dilated retina evaluation to make sure that there is no diabetic retinopathy damage. But unfortunately, if you find that there is already some retinal damage, make sure to follow the medication, follow the healthy lifestyle, keep the sugar levels under control, and have a regular follow-up. All these changes will be a long-term process. Diabetic retinopathy, most of the damage, as we see, it does not cause immediate damage except for proliferative changes. But once they are damaged, since the aggravating factor is too high, the damage is too high, causing the visual loss, we have to be very cautious. I hope this video will bring awareness among our population, irrespective of the diabetic status, to make sure to have a proper retina checkup. At the same time, have a glycemic profile also, how your HbA1c, how your sugar levels are, and this should include in conjunction with a healthy lifestyle. I hope we can discuss more about this once we see the patients in person and have more videos. But kindly share with your colleagues, your friends, and more so follow it to make sure we don't fall into the prey of diabetic retinopathy. Thank you so much, and we'll see you back.